Welcome back to the Medical News Update podcast. Today we're talking about an exciting new study published in the New England Journal of Medicine. It's about how controlling blood pressure more strictly could help people with type 2 diabetes avoid serious heart problems. Let's unpack it in a way that's easy to understand. First, you might wonder, why does blood pressure matter for people with diabetes? Well, high blood pressure is incredibly common in diabetes and increases the risk of heart attacks, strokes, and other major cardiovascular problems. It's a big deal, and doctors often recommend lowering blood pressure. But the question this study asked was, how low should we go? To figure this out, researchers in China worked with over 12,000 adults aged 50 and above, all with type 2 diabetes and high blood pressure. These participants were split into two groups. One aimed to lower their systolic blood pressure, the top number in a reading, to less than 120 mmHg, while the other aimed for less than 140 mmHg. For 5 years, doctors closely monitored their health to see which approach worked better. So, what did they find? In the group with stricter blood pressure control, fewer people had heart attacks, strokes, or heart-related deaths. Specifically, there was a 21% reduction in these events compared to the group with less strict control. That's a big improvement. However, this intensive approach also had some trade-offs. While overall safety was similar between the groups, the stricter control group had slightly more cases of low blood pressure and high potassium levels. You might now be asking, does this mean everyone with diabetes should aim for a super low blood pressure? Not necessarily. The study shows clear benefits, but it also highlights the importance of careful monitoring, especially for side effects like dizziness or changes in potassium levels. It's a balancing act that doctors and patients need to discuss together. In conclusion, this study gives strong evidence that aiming for a lower blood pressure in people with type 2 diabetes can significantly reduce the risk of serious heart problems. But as with any treatment, it's about finding the right plan for each individual. If you or someone you know has diabetes and high blood pressure, this is a conversation worth having with a doctor. Thanks for tuning in to the Medical News Update. If you find this information helpful, subscribe for more updates, and let's keep exploring the latest in health research together.